you leak a little bit of urine when you cough or sneeze, this video is going to go over just a couple tips to help you if you are somebody that experiences leaking with a cough or a sneeze. So a cough or a sneeze, that increases pressure in our system. Our pressure often goes out at the weakest points, and if that's the pelvic floor, then that's gonna lead to leaking a little bit of urine. It can be a small amount, a big amount, any amount. Is very common postpartum, but it's not normal. So I just am here to tell you that this does not have to be your normal. So if you are experiencing this after the first couple weeks postpartum, then this is definitely something you want to get assessed by a pelvic floor therapist or talk to a pre or postnatal specialist about that to help you and get an individualized assessment for you as well. So just a couple tips to help out though. The first thing is the Knack Maneuver. Basically what that means is you are proactively contracting your pelvic floor muscles prior to a sneeze or a cough. Okay, so your pelvic floor muscles should work in advance of a movement. So if I am going to reach for something, my pelvic floor muscles should kind of kick on automatically there to stabilize my pelvis and spine, prevent me from leaking, things like that. So when it comes to a cough or a sneeze, if you can tell you're about to sneeze, try that Knack Maneuver. So basically you're doing a pelvic floor contraction right before you're about to sneeze or as you're sneezing to help prevent that leaking. Okay, so you're squeezing and lifting those pelvic floor muscles up and in as you're coughing or sneezing, and see if that helps. That's one tip. So the Knack Maneuver, that's what that's called. The other tip is, how are you standing when you're coughing or sneezing? If you happen to be in standing, that's often when it happens. If you're standing like this, with your butt clenched and tucked, that's actually going to set you up to leak rather than if you're in this position, if you're slightly leaned forward. This is actually a better position to have our pelvic floor muscles be able to engage and stop that leaking. So, and if you're someone who tends to tuck under like this, next time you feel like you're about to cough or sneeze, try leaning slightly forward at your hips. Okay, so I'm not way like this, but just a slight lean forward. So still ribs stacked over your pelvis and your hips here. Next time you're gonna cough or sneeze, try doing this position, okay? See if that helps. So those are two quick tips to help you stop leaking when coughing or sneezing. If you are still experiencing leaking after trying these tips, then I definitely recommend seeing a pelvic floor therapist or pre or postpartum specialist to discuss this more.